I'm Dr. Alexander Balan and would like to discuss in this short video kleptomania, very interesting subject that does not occur too much in the population, but still interesting. Let me give you one of the example. When you are going to the store or market, you can have some thoughts like to get any of the product for free or anything like that, or do something for fun, but you have a reason, you have a rationality, and you will not do this. If you want, you just choosing the product and going for paying this. In times that kleptomania is something like getting products without paying and without reason. Let's go with some definition like kleptomania is recurrent inability to resist urges to steal items that you generally don't really need and that usually have little values. Kleptomania is a rare but serious mental health disorder that can cause much emotional pain to you and your loved ones if not treated, of course. Kleptomania is a type of impulse control disorder. You cannot control this. A disorder that is characterized by problems with emotional or behavioral self-control. Patients who have an impulse control disorder also have difficulty with resisting the temptation or drive to perform an act that's excessive or harmful to them or someone else. Many people with kleptomania live lives of secret shame because they are afraid to seek mental health treatment or a doctor. Also, there is no cure for kleptomania. Treatment with medication or talk therapy can help end the cycle of compulsive stealing. What could be the causes of kleptomania? The cause of kleptomania is not known. Several theories suggest that changes in the brain may be at the root of kleptomania. Kleptomania may be linked to the following. Problem with naturally occurring brain chemicals. One of the neurotransmitter called serotonin. Serotonin helps regulate moods and emotions. So low level of serotonin or 5-hydroxytryptophan are common in people prone to impulsive behaviors. Addictive disorders like stealing may cause the release of dopamine, another neurotransmitter. Dopamine causes pleasurable feelings, and some people seek this rewarding feeling again and again. And the brain opioid system urges are regulated by the brain's opioid system. Any imbalance in this system could make it harder to resist urges. So when when people doing this with kleptomania, doing some of the stealing, they feel this release or some of the pleasure after the act of stealing. How about risk factors? Kleptomania is considered uncommon. However, some people with kleptomania may never seek treatment, as I said you previously, or they are simply jailed after repeated theft. So some common cases of kleptomania may never be diagnosed. So you are stealing till you are jailed. Don't do this, of course. Often begins during the teen years or in young adulthood, but can start in adulthood or later. So some symptoms or a history of stealing you can see even in childhood. And about 2/3 of people with kleptomania are women. So 1/3 of cases could be men. So men, you can stay relaxed in this way. Risk factors, so there are two main, like family history and having another mental illness. Having a first degree relative such as parent or sibling with obsessive compulsive disorder or substance abuse may increase the risk of kleptomania. Also, having another mental illness like bipolar disorder, anxiety disorder, eating disorder, or as well as substance abuse or substance use disorder could contribute to development of kleptomania. Symptoms may include inability to resist powerful urges to steal items that you don't need. You are stealing them, and after decide that you don't need them, and even you can leave them. Feeling increased tension, anxiety, or arousal leading to the theft. Feeling pleasure, relief, or gratification while stealing, or just after doing this act. Feeling terrible guilt, remorse, self-loathing, shame, or fear of arrest after the theft. Return of the urges and the repetition of the kleptomania cycle. Every time you are going at the places where you can produce this theft of any of the object or product, you are against impulsive to do this. Features. So unlike typical shoplifters, people with kleptomania don't compulsively steal for personal gain or dare for revenge or out of rebellion. They steal simply because the urge is so powerful that they cannot resist it. Episodes of kleptomania generally occurs spontaneously and usually without any plan or even without any help or collaboration from another person. You are doing by self-it. Most people with kleptomania steal from public places such as stores or supermarkets. Some may steal from friends or acquaintances, such as at a party. Often the stolen items have no value to the person with kleptomania, and the person can afford to buy them, but instead doing theft. The stolen items are usually stashed away, never to be used. Items may also be donated, given away to family or friends, or even secretly returned to the place from which they were stolen. Urges to steal may come and go or may occur with greater or lesser intensity over the course of time. Do kleptomaniacs have some complications? So, left untreated kleptomania can result in severe emotional, family, work, legal, and financial problems. For example, you know stealing is wrong, but you feel powerless to resist the impulse. So you may be wrecked by guilt, shame, self-loathing, and humiliation. And finally, you may be arrested for stealing and jailed. So other complications of the kleptomania could be impulse control disorders such as compulsive gambling or shopping, substance abuse, alcohol or substance abuse misuse, personality disorders, eating disorder, depression, of course, anxiety, some suicidal thoughts, or even attempts. And now it's time for treatment. Also, fear, humiliation, or embarrassment may make it hard for patient to seek treatment. It's important to get help, as kleptomania is difficult to overcome on your own. Without treatment, kleptomania is likely to be ongoing or long-term condition. So there are two types of treatment, like medication, psychotherapy, or even both. Medication and addiction medication called naltrexone, an opioid antagonist, which may reduce the urges and pleasure associated with stealing. And of course, antidepressants like SSRI or selective serotonin reuptake inhibitors, which helps very well as increasing the level of serotonin, which is a cause of the kleptomania, the main one. And psychotherapy, a form of psychotherapy called cognitive behavioral therapy, helps to identify unhealthy negative beliefs and behaviors and replace them with healthy positive ones. So, cognitive behavioral therapy may include these techniques to help you control urges. Convert sensitization, in which you picture yourself stealing and them facing negative consequences such as being caught. Aversion therapy, in which you practice mildly painful techniques such as holding your breath until you become uncomfortable when you get an urge to steal. And systematic desensitization, in which you practice relaxation techniques and picture yourself controlling urges to steal. And the last line is avoiding relapses. To help avoid relapses, be sure to stick to your treatment, to take medication which were prescribed to you. And if you feel urges to steal, contact immediately your mental health professional or doctor, or reach out to a trusted person or support group. And don't leave it untreated or without attention for someone who can help you. Thank you very much and have a great time.